He goes to hotspots around the country and helps to boost staffing at hospitals in need. Grover Street comes to us now live from Southern California. Thank you very much, sir, for joining us. I understand, before we get to what you're doing in various hospitals around the country, that you've actually just tested positive for COVID yourself and that you're in isolation. How are you doing?
I'm actually doing pretty good right now. I tested positive back on November 3rd, and the only symptoms I had was loss of taste and smell.
Okay, so you're okay now. I want you to talk about what you've been doing the past year, the last few months. Unlike most of us, you're actually chasing the virus around the country, following these surges. What has it been like?
It's been a very unusual experience since March of this year, and it's a great opportunity to learn more about the virus and about the way people act, and the different treatment modalities that we're experiencing. And it's also interesting to me that some of the hospitals, they approach it differently than other hospitals. Not everybody has the same approach. I think if they were to develop an algorithm that could be used for the treatment of COVID in healthcare, it's always based on evidence-based practice. And when you get an algorithm, then I think that would help treat some of these patients in a better way.
So what are you saying? There needs to be more consistency? Because I understand, I think you started off in New York when the surge was there, then you went to Miami, now you're in California, you're helping out at different hospitals who need you. Are you saying there needs to be more consistency across the US and how to manage this?
Yeah, yes, ma'am. More consistency in the way they treat it and the approach that they do it. Now, it's different based on the patient. Not everybody has the same symptoms, and you can't approach it the same treatment modalities or regime in one patient versus another. It just depends on on the patient.
You started your career, your medical career, as a nurse in the Air Force, and I know we've got some pictures there of you on the front lines with your military training. And how has that helped you? I know our previous guest on Sarah Seidner's piece said this is like a war zone, that you're on the front line. Does it feel like that?
Yeah, it's interesting, and it is that that simple fact that people are making that comparison, that it's sort of like it is a war. And the weapons that we have to use is not guns or grenades or ammo or bombs. It's actually wearing a face mask. That's the weapon we need to use. And that's what we're going to have to do and get better at doing in order to be able to contain this and, have more control over what's going on in our society.
From a personal perspective, what's it like? What's been the hardest part about having to parachute into many of these hospitals where the staff so need you so much? What has been one of the most difficult things?
Well, I've seen several things with other employees and staff members. There's a lot of job burnout in different facilities, and you see nurses quit and doctors walk off the job and they just can't handle the stress load. With me, however, I mean, I've learned to adapt to change, and I think that's something the military taught me. I'm always ready to take on a challenge, and it's actually motivates me to see somebody get better. And I've had patients that actually have gotten better, but the majority of the patients that I've taken care of have not gotten better.
And what is that like, to be with people, particularly if they're dying and they're alone?
And you know what? These people are alone in the hospital. They have families. I've been on the phone numerous of times letting family members know, hey, your mother may not make it tonight, or your father or your loved one. And they have people on the outside, but it's hospital policy and the CDC recommendations that we control the population of well people that are coming through the hospital and to limit visiting hours. And there's actually no visiting hours right now. And to know that their loved ones may go into a hospital one day and not come out, they'll never see them again, and this is happening.
What do you tell those people who might not leave the hospital and they can't say goodbye properly or have a hug with their loved ones, and you might be the last person they speak to? What do you tell them?
Well, if they're in a position, it depends on the patient now, because I work ICU, and if they're intubated, they really don't have any reference. You can't really talk to them in that manner. But if they are on BiPAP, I mean, treatment, if they're not intubated, you talk to them and just give them a level of confidence that, we're here for you. We are your family. And that's just like working in every hospital when nurses and doctors get together, respiratory therapists, CNAs, all the medical professionals that are working together. We're like a family, and we have to bring it together like a family, and not just us as workers, but with the patients as well. We have to accept them, and it becomes emotional. There's a lot of emotional things involved with this kind of disease.
Grover Street, thank you very much for joining us. Thank you so very much for all the work you've been doing, and no doubt all the hands you've held over the past few months. I hope you keep up your strength and have a beautiful Christmas season.
Thank you too. All right.
All the best.
Right.
You are watching CNN. Still